Dr. John Lovejoy Jr., a retired orthopedic surgeon from Jacksonville, had been volunteering through the Crudem Foundation at Hospital Sacré-Cœur in Milo, Haiti for over 10 years when Haiti was ravaged by the earthquake of 2010. I called as soon as I heard about the earthquake and found out that our hospital was intact, says Dr. Lovejoy Jr., who then organized a U.S. medical response team, enlisting his son, Dr. John Lovejoy III, at the time an orthopedic surgeon at Children's National Medical Center in Washington, D.C., to help lead the medical relief efforts. Arriving in Milo 4 days after the quake, the Lovejoy team transformed the 73-bed Hospital Sacré-Cœur into a 550-bed MASH-like unit, performing more than 180 surgeries, many of them amputations, and treating over 400 injured patients that first week. What really got to him in Haiti was seeing all the amputations in children because of delays to immediate medical care. The catastrophic impact of the quakes created a generation of amputees in a country where there were 0 certified prosthetists, Dr. Lovejoy Jr. says. Dedicated to teaching the Haitians how to help themselves, he designed, procured funding for, and built a state-of-the-art prosthetic lab in a 40-foot container, shipped it to the hospital in less than 4 months after the earthquake, and personally sponsored and funded the training for local Haitian students to become certified prosthetists orthotists. Today, we have 5 orthopedic teams that travel to Hospital Sacré-Cœur throughout the year, with each team comprised of residents, anesthesiologists, operating room nurses, physical therapists, support staff, and more, Dr. Lovejoy III says. The goal is to give the Haitian healthcare community the tools, supplies, and training necessary to provide good medical care to their fellow countrymen. Thanks to the Lovejoy's efforts, Hospital Sacré-Cœur is now staffed with a full-time, well-trained orthopedic surgeon who, according to Dr. Lovejoy III, has changed the dynamics of care by collaborating closely with the visiting teams, coordinating surgery and treatment schedules, providing expert surgical and follow-up care for his own patients and patients managed by the visiting teams, and ensuring a more steady continuity of care at the hospital. Dr. Lovejoy III, who moved to Orlando in early 2014, is a fellowship-trained pediatric orthopedic surgeon at Nemours Children's Hospital and adds a sorely needed subspecialty to the ranks of Brevard physicians with a satellite office here in Brevard County. The Lovejoys say that their propensity to channel their time, talent, and treasure into altruistic endeavors can be traced back to the influence of their father and grandfather, John Lovejoy Sr., who throughout his career working through crippled children's services selflessly contributed his time and expertise to benefit the less fortunate. This selfless service that he demonstrated certainly had a major impact on his family legacy. 2015, Central Florida Humanitarians, Dr. John Lovejoy Jr., and Dr. John Lovejoy III.